Frank.
Catherine, thanks. Dr. Ron Suprenant joining us this morning to talk about, going back to school here, because we have our back to school supply checklist that we go to the, school supply store to get. But how about a medical checklist? Doctor, good morning to you.
Good morning.
Thanks for coming in. Okay, what's the number one mistake folks make, when the kids are going back to school? I remember back in the day, we would always go to the doctor before back to school. I don't know if folks do that as often.
I think the number one thing is that they procrastinate.
Yeah.
So yes, they need to be going to see the doctor and making sure that their child's immunizations are up to date.
Now, when you talk about immunizations, which ones are some of the big ones that you want to make sure you have up to date right now?
Well, some of the ones we hear in the news that I think are being missed, influenza has to be done every year, and that's for every person age 6 months and older.
Now, is it too early to get your flu shot right now?
No, as soon as your doctor has them, you can get them.
Okay.
And then measles, we've had outbreaks of measles around the country, it's a big one. But your doctor can tell you exactly what immunizations your child needs, and the school will tell you because they're required to check those as well.
Yeah. What about the daily, the germs here and there, you're going in. Hopefully the schools are clean right now, right? But, a couple days, little kids start getting the sneezing going on, basic washing the hands.
Yeah, it's a good time to go over it with your children. Talk about hand washing, about protecting, covering their nose and mouth if they sneeze and cough. So absolutely, spreading of infections is big during school years or school days because the children are so close in contact with each other.
What about the things, hearing, eyesight, all those things? I mean, just because you didn't need glasses last year, you might have some vision problems this year.
Yeah, an annual eye exam is actually recommended for all children.
Okay.
It's very easy for that to be missed because the parents don't notice. The child either has always seen things that way, or the change has been so gradual that the child didn't notice a problem.
Didn't notice it right there. Dental work, orthodontic work, all that stuff.
Yes, regular dental checkups is important too.
Yeah. What do you think, too, when it comes to like school injuries, athletes, sports? I mean, obviously when you get to the higher level, you have, in-house doctors and whatnot, or, orthopedics there to keep an eye on. But I imagine you make sure your body's conditioned.
Well, you're absolutely right. Part of the annual physical can be to include a sports physical for the child, and then it's important that the child listen to their coach and be careful what they do. You shouldn't work out too much in very hot weather.
Right.
There's been incidents occurring with that, and then building up gradually. Don't start doing something that you haven't done ever before and then do it full blast. You need to build up your conditioning.
And the key is those immunization shots. That really is
Yes.
the key here. Very good. Well, Doctor, thanks so much. Good to see you again. If we want more information, where can we find you?
BuckeyeHealthPlan.com.
Perfect. Thanks so much. We appreciate it, Doctor. Thank you. Okay, our time right now is 19 after 9. Our Lauren Minor, speaking of back to school, the college kids, they're back too. You see.